There are two components of the treatment of breast cancer. The first one is minimizing the risk of it coming back in the breast, and the second one is minimizing the risk of it spreading. So the choices for minimizing the risk of it coming back in the breast are either to do a mastectomy or to do a lumpectomy, which is removing the tumor with a generous margin, and that has to be followed by radiation. So that's how we use radiation in early stage breast cancer. If you're going to get chemotherapy, the chemotherapy is given before the radiation, because the risk if you have breast cancer is of it spreading, so you want to deal with that risk first, and then you give the radiation after the chemotherapy is finished. Breast cancer is very easy to treat. All you're doing is treating the breast tissue, a tiny bit of lung and the ribs. So a lot of these emerging technologies are not necessary to treat breast cancer. These emerging technologies are valuable when you're treating a tumor near a vital organ like the spinal cord or next to the eye, where you really want to get a high dose to the tumor and minimize the dose to the normal tissues. You don't have that issue in breast cancer. So we don't use these techniques like IMRT for treating breast cancer normally. The only time we would use the intensity modulated radiation therapy is if you have a left-sided breast cancer and there's a lot of heart in the field. That doesn't happen that often. The radiation is every day, Monday through Friday, for 6 to 7 weeks. The treatments take about 2 to 3 minutes. You'll be in the radiation department about half an hour each day. And the way the radiation is done is you lie on a table with your back supported and both arms up above your head. The machine that gives out the radiation is called a linear accelerator, and it gives the radiation from 2 directions, so the breast is trapped between the 2 beams. You don't feel anything. It's just like getting an X-ray. During this 6-week period, there are 2 side effects you may get. You may get a little bit tired, but most people can work during the radiation. They're not that tired that they can't work, and there's no restrictions on your normal activity. The main side effect is that after about 3 to 4 weeks, the skin will get red like a sunburn, and we have a lot of suggestions how to minimize this redness with the skin care guidelines we use. The redness will go away 2 to 4 weeks after we finish. So the main downside of the radiation is the length of time it takes to give it. But it's usually very well tolerated.